Roll back on your back. So if I were going to treat her neck, what I would be doing is I could use this hand to sort of guide what happens above my finger. I can sort of, I don't like the word blocking, because that means I'm going to cram the joint to the end range, and then I think I'm going to stretch the joint, and that's not at all what I'm doing. What I want to do is I want to create, see if she will allow the joint above my finger to move all the way through its range of motion. It doesn't move a tremendous distance, and I'm mostly interested in what happens is she initiates the motion. And you think, oh, she's lying down and she's relaxed. I guarantee if you take a quadriplegic and you lift their head and they're not able to use any of the muscles in their neck weighs a ton. So although you may think that the person isn't using their muscles, she's assisting me even if she's super relaxed. So when I'm moving her, she's actually controlling the movement with her postural reflexes. And if I do it slowly enough, I'm not trying to shove all the way to end range. If I do it slowly enough and just guide the joint between my fingers, if I get it to move a whole lot in relation to the joints next to it, that means that she's able to control her motion intrasegmentally. And the default, the aberrant response is, as you try to move this, the muscles, the reflexes aren't working in the area, and they're not getting the proper proprioceptive feedback, and they default to just stiffening their spine, and it won't move. And that's what we're feeling when we're evaluating someone, is that stiffening with the superficial muscles. Okay, Tom's gonna hate this. Whatever. Okay, so that's what that looks like, and then while I'm here, so I'll just show what it looks like. So if I was going to treat her thoracic spine, so roll over towards me. Bend both your knees up. So what I'd have her kind of in a neutral position. Here's her spine. That's her spinous process here. And what I'm doing is I'm stabilizing here. And I don't like that word because so this is the end of her motion. I'm not trying to make her go further. I'm trying just to get her to move, initiate from an anatomically neutral position. I'm trying to just get her to go through her motion. There's no reason not to go to the end of her motion, but I'm not certainly trying to go any further. I would say most likely you go 50% through their motion, and they're able to let you do that without a reflex response. So you have to go slowly, and you have to, if you feel the person reflexively tighten up, which some people would say, oh, they're guarding, that word might work, I don't know. But what you want to do is you just want to move this joint in between your fingers a whole lot in relation to the joints next to it. And this is like a practice exercise. Sally's learning a skill right now. She's learning she's practicing moving her facet joints without reflexively defaulting to using more superficial muscles. It's a skill. It's a practice. If she had an aberrant arthrocanonic reflex through here, she would have lost the skill of controlling her motion segmentally. And now we're just going to practice moving it. And that's the extent of the treatment. I could sort of get her, I could work with flexion and have her practice. Now some people may say, okay, well we can add in some active kind of, I'm going to try to teach her to contract the muscles segmentally and isolate the motion. I would say that that's completely unnecessary. There's nothing wrong with that. But she's actually actively using her muscles to control her motion, even though I'm saying she's relaxed, she's saying she's relaxed, having worked with people who are who are paralyzed, they can't lie on their side. I mean, you have to wrestle with them to get them on their side. We're using our muscles when we're lying on our side. We're using our postural reflexes even though we think we're relaxed. We are not relaxed.